Summer is here and I'm talking to you from Hotlanta. My selections for the June issue are from the Oculoplastic, Body Contouring and Facial Surgery sections, all accompanied by commentaries. Don't miss the 3 international translated abstracts this month in Turkish, Korean and Chinese. Next month, look for them in French, Portuguese and Spanish. You'll begin to notice that articles from breast surgery section will have new names as we go forward: aesthetic breast surgery and aesthetic breast reconstruction. We welcome you to submit to both sections. As always, I invite you to listen to this month's podcast series, one of my editor's choices from the body contouring section, the British Association of Aesthetic Plastic Surgeons, BAPS, Gluteal Fat Grafting Safety Review and Recommendations. As always, I encourage you to listen to the monthly ASJ Open Forum podcast series. From the Oculoplastic Surgery section, I have picked this article, which deals with overgrafted fat in the eyelid. Always a challenging problem. The original article from Dr. Shoaib Ugrada and colleagues offers recommendations on the diagnosis and management of complications related to grafted lumps, bumps, and contour irregularities. The commentary by Ms. Alexandra Townsend and Dr. Oren Tepper commend the authors for helping to guide treatment of this complex problem. They particularly commend the depress and roll maneuver and their use of controlled lipolysis. From the breast surgery section, the efficacy and associated learning curve of office-based high-resolution ultrasound to detect shell failure in breast implants. The application of ultrasound in the office to evaluate implants is gaining in popularity. This special topic by Ms. Sarah Ferenes and co-authors showed that the use of high-resolution ultrasound can be very effective in detecting shell failure in breast implants and improving the accuracy of findings after only 60 scans with the technique. The commentary by Dr. Brad Bengston recommends bringing the ultrasound into the operating room, scan patients, and then immediately have feedback. He also comments that everyone needs a better breast implant screening method, including the FDA, implant manufacturers, plastic surgeons, and most importantly, our patients. The body contouring section is the British Association of Aesthetic Plastic Surgeons Gluteal Fat Grafting Safety Review and Recommendations. As surgeons, we all know the risks associated with BBL and the evidence on the safety of subcutaneous lipofilling. And recently, regulators have begun to suggest that in some states insist on the use of guided ultrasound to improve patient safety. This international review article from the UK by Dr. Omar Tillo and colleagues summarizes the recommendations of BAPS. The authors remind us that patients seeking surgery at unregulated facilities or through medical tourism are at higher risk of serious complications. The commentary by Dr. Pat Pasmino commends BAPS for emphasizing subcutaneous-only grafting, and he recommends the introduction of ultrasound technology that can make grafting a safe, reproducible procedure. From the facial surgery section, establishment of the safety of the hemostatic net utilizing laser-assisted fluorescence angiography with SPY-Q software. The question has always been raised, is the hemostatic net safe, and do these sutures restrict dermal perfusion? That's the focus of this preliminary study reported by Dr. Milind Kasher and colleagues, who found no decrease in tissue perfusion with the technology that they used to evaluate it. Commentary by Dr. Jim Grotting elucidates the importance of visual inspection of the skin within 4 hours of applying the net to ensure that swelling hasn't occurred. He hopes that the article will also stimulate further investigation and innovation in the concept of dead space closure, as well as molding and securing of the skin to influence the way it contracts and heals. That's it for June. We'll be back in July.